Good morning. Welcome to the webinar for the Occupational Therapy program at Hofstra University. I'm pleased that you are able to join us. And if you have any questions, please feel free to type them and we will answer them as we go along. In this webinar, we want to address several questions. What do occupational therapists do? Where do they practice? What is the knowledge base? What is the educational process? What are the expected employment outcomes? It's likely if you are attending this webinar that you already have some information or some knowledge about these questions, but I will still review them. And if you have any additional questions about it, please feel free to ask the question. So what is occupational therapy? Occupational therapy is a profession that includes evaluation, implementation of interventions, and occupational therapists help individuals at all ages across the lifespan, from birth to elders. The goal of occupational therapy is to help individuals participate in the things they want and need to do, to help them to develop, maintain, and recover their functioning in terms of anything that is required in their daily life. Okay, I mentioned occupation. Many times if people are unfamiliar with occupational therapy and they hear the word occupation, they think of what do you do as a job? What is your occupation? And in occupational therapy, we think of occupations as those activities that are meaningful to the individual. And as occupational therapists, we look at occupations from several different perspectives. These are the areas, activities of daily living. And those are the things that people need to do just to live, for bathing and dressing and eating. So an occupational therapist might be involved in helping an individual to do those things because of an injury or because of a birth defect or some deficit related to functioning. Instrumental activities of daily living, and those are the activities related to managing household or pets or education, work, leisure, play, social participation, rest and sleep. And when rest and sleep was added as an area of occupation that occupational therapists deal with, there was some question, how is occupational therapy involved in rest and sleep? As we have come to know through neuroscience and the information about functioning, is that rest and sleep are very important for an individual to be able to function. So an occupational therapist might be involved in rest and sleep in terms of the environment or the physical aspect in terms of setting up the environment, or helping the individual in terms of looking at habits and routines related to rest and sleep. So, as I indicated, OTs use occupations, and occupations are those activities that are meaningful to the individual. And our goal is to help an individual live life to the fullest. That's actually the brand that is used. If you go to the American Occupational Therapy Association website, www.aota.org, you'll see this phrase, live life to the fullest. That is the goal of occupational therapy. So our knowledge base is pretty broad, and if anyone is interested in occupational therapy, they will often ask a question, well, why do I have to have courses in the biological sciences and psychology and in the arts. And it's because occupational therapy and occupational therapy therapists work in so many different areas in terms of helping individuals to perform activities of daily living and to function, that the knowledge base is pretty broad. So an occupational therapist has to have knowledge about the biological sciences, the psychological sciences, as well as these other areas that are listed. So our educational curriculum for all occupational therapy programs is based on accreditation from the Accreditation Council for Occupational Therapy Education. And it's often referred to as a code. Our educational program has 189 standards that are set by a code that these standards have to be met in order for us to proceed to move toward full accreditation. So the first step in the accreditation process was we had to submit a report to a code to identify how we would meet all of these 189 standards. And we had to look at what are the basic tenets, the theoretical perspective. How will we as a program meet the standards for accreditation in as an occupational therapy program? We submitted our report, our first report, in January of last year. The Accreditation Council met in April and awarded us candidacy status. At the time that the council met, there were three options that could have been, three possible actions. It could have been deny, defer, or to award candidacy. Our program was awarded candidacy. And the next step in terms of the accreditation process was once we have admitted students, and we did admit students, our first inaugural class this fall, we will submit another report, and a code will look at the report and then visit. A code has made as a goal that any program which has candidacy status to look to make a determination about full accreditation before the first class has graduated. So we will know about our full accreditation status by 2017 next summer. It is based on our resources and what we have established so far. We fully intend to meet the standard for full accreditation by the time the first class graduates. So our program, students must graduate as part of the accreditation standards, must graduate from an accredited OT program. All courses, and then after courses are completed, there is a requirement to do 6 months for level 2 fieldwork, which is an internship. And it is required that students do 2 3-month level 2 fieldwork placements. Our program has a community focus. There are 16 credits for in our curriculum. And in each semester, students have a level 1 fieldwork experience. Level 1 fieldwork is really for observation and to be able to have some sense of what are options for occupational therapists, and really to just have some sense of the human service delivery system. Once students have completed all of our coursework, they then are placed in level 2 fieldwork placements. Once students complete the fieldwork, they can then sit for the board examination. In our program, there are, as I indicated, experiential component beginning actually in the first semester for level 1. And because our program is situated in the Department of Health Professions, where there are other health fields, public health, exercise science, there are opportunities for interprofessional learning and service opportunities. Okay. Okay. The application process for the program is through the Centralized Application Service, referred to as OTCAS. The deadline for application is February 1st for the subsequent semester. Admission requirements as listed on this slide: a baccalaureate degree, GPA minimum of 3.0, 3 letters of recommendation, a personal essay identifying areas of interest and reasons for seeking advanced training in occupational therapy. And there are some prerequisite courses. The prerequisite courses can be in progress, but must be completed before the program begins. There's an interview process, and there is an on-site essay. This is a listing of the prerequisite courses: abnormal psychology, developmental psychology, human anatomy. In many cases, it may be A&P, anatomy and physiology together, 1 and 2. Social behavioral science course, structural and mechanical kinesiology. And this is a course that is often asked about. And if the course focuses on movement related to human action, it may not have the same name as structural and mechanical kinesiology. It may be kinesiology, or in some cases it might be biomechanics, but the focus should be on human movement. There is a prerequisite OT course that is required, and it's an online hybrid course, and it must be taken at Hofstra University. The employment outlook for occupational therapists, as many of you may already know, is really good. In 2005, U.S. News and World Report ranked occupational therapy as a profession as number 9, and in terms of healthcare jobs, and in terms of best jobs, ranked occupational therapy as number 13. The Department of Labor, the Occupational Outlook Handbook, indicates a bright future in terms of employment for occupational therapists. Job outlook is projected to be much faster than average at 29%. If you have any additional questions, this is my contact information, and you can feel free to contact me. There are some questions that have been asked. Is Hofstra on track to be fully accredited? What is the chance that the program will not be accredited, and how will this affect students? Yes, Hofstra is on track to be fully accredited. I have had some experience with accreditation in previous employment as a program director, where the program was awarded 10 years reaccreditation. That's the highest number that a program can be accredited. Hofstra has resources that it would indicate that we would be fully accredited. If we are not accredited, and I do not expect that to be the case, that a coach would work with us to make sure that any deficits were corrected, or we would seek to have students go to other programs. This is not, I think, a viable option. I think that occupational therapy program at Hofstra will be fully accredited. My current institution does not offer kinesiology. Is there an opportunity for me to take it at Hofstra before beginning the program? Hofstra does offer kinesiology. It is a course that fills up really quickly, even though it is offered each semester. So it is possible to register to take the course at Hofstra, but also there are options to take it at other institutions and have it transferred in. Many, especially programs that offer either pre-OT or an OT, occupational therapy assistant, or physical therapy assistant program, or an exercise science program, will often have kinesiology as a course that could be taken there. Does the GPA include all coursework? Does it include courses taken after an undergraduate degree? Yes. The GPA requirement includes all coursework, and also it includes courses that are taken after completion of the undergraduate degree. I studied sports medicine with a concentration in OT. Would the intro to OT course in the program count toward the pre-OT HPR 130 requirement? No. We want to make sure that students have come in with a background that is consistent with our curriculum, and that we know that the material that is covered has been, students have the same background. What types of settings will the level 2 fieldwork be like? Hospital settings, SNF? Do students have a choice with this? In terms of our accreditation standards, students will have to have experience with adults, with children, with individuals across the lifespan. So we would look at options in terms of making sure that the site has the resources and would also be consistent with our curriculum. Students will be placed in hospitals, in community settings, in school districts. The students have some opportunities to collaborate with the academic fieldwork coordinator, but in terms of making individual choices, we want to make sure that the learning experience is a useful one. So it would not be primarily the student's choice in terms of a fieldwork placement. Do you need to take the GREs? No. Can kinesiology be taken online? Well, it depends on the kinesiology course. Because there is usually some kind of experiential component with kinesiology, with analyzing human motion, it would depend on the course. It may be a possible option. How does the admissions committee evaluate repeated courses? Will the overall GPA include both repeated and original grades? Is the overall GPA favored or the prerequisite GPA? We look at the prerequisite GPA very carefully because the prerequisite courses really provide the foundation for the program. The overall GPA in terms of repeated and original grades, we really would look at just at the overall GPA, not necessarily whether or not it was repeated or not. How do I register for the OT online hybrid course? Does this course need to be completed before the start of the program? Yes, the course does need to be completed before the start of the program. This course is offered in the fall, spring, and summer. So we would contact the university, I guess, and graduate admissions. Can your letters of recommendation be from anyone, or do they need to be from occupational therapists? The letters of recommendations can be from anyone, but we do look to see if there is a recommendation from an occupational therapist, or maybe from other kind of health professionals, or someone who has some sense of the individual's potential capacity to work as an occupational therapist, or to be able to participate in graduate studies effectively. Would it be possible to have a copy of the presentation sent to us via email? Yes, it will be put on the website. If I received a C in one of my prerequisites and plan to retake it over the summer, would I still have a chance of making it into the program? The admissions committee will look at the application material, and in some cases, students are still in the process of taking prerequisite courses, so that can be indicated on the application or in some kind of addendum. In terms of whether or not the person would be able to still have a chance of making it into the program, we would look at the individual's application in terms of the overall candidate pool. And whether or not someone is taking a course in the summer does not rule them out as for consideration for admissions. When does the semester begin? When do we need to have prerequisites finished by? The semester begins in the fall. Prerequisites need to have been completed before the fall semester begins, which is usually in September, sometimes maybe late August. Do we need to have a certain amount of hours in the occupational therapy field prior to starting the program? No. It is desirable to have some observation hours, but it's not a requirement. One of the reasons for the pre-OT course is that students have information about occupational therapy practice because from practitioners who are in the field. And so the idea behind observation hours is so the students or applicants have some idea as to what the field is all about. So volunteer hours are desirable if that's possible, but also the pre-OT course addresses the intent of the observation hours. Regarding documentation of observation of OT, related experience, will you accept my level 1 and level 2 fieldwork experience from OTA school? Well, the level 1 and level 2 fieldwork experience from OTA school is really from the perspective of an occupational therapy assistant. If the observation indicates some awareness of the practice of occupational therapy from the perspective of the occupational therapist as opposed to the technical aspect of the OTA, it might be considered. Are the fieldwork placements assigned? No, fieldwork placements are assigned. You do not need to acquire placements on your own. In fact, that is really not viewed positively at all. In fact, practitioners or sites do not want students contacting them about fieldwork placements. Fieldwork placements are assigned. If we apply before the deadline, what would be the soonest we would find out about admission to the program? We will start looking at applications in the late fall, early winter, and we should. The earliest probably would be late January or early February, because the deadline for applications is really February 1st. When is the latest that we would find out if we got accepted into the program? The latest would probably be April. Is there a set curriculum each semester that every student takes? Can we take classes in other programs in the Department of Public Health Professions? There is a set curriculum and courses that every student takes. It is a cohort model. And as I, excuse me, and as I indicated, the accreditation standards includes 189 standards, and which means, and because of our knowledge base is so broad, we have to assure that the coursework covers all of those 189 standards. There is in the last semester an option to take an elective course. And that elective course could be in another discipline, or it could be an independent study, or it could be working with a practitioner to do some kind of independent work, or looking at an emerging practice area. So there is one course in the last semester where it's possible to take an elective course. Does the admission require a particular number of volunteer or observation hours? And if so, how should documentation of these hours be submitted? There is no requirement in terms of a particular number of observation hours. For documentation of these hours, we do not have a specific form, so it can be done in several ways. It could be the timesheet that is used if such is used at a site, or it could be a document which lists the hours and the sites and some kind of confirmation of the supervisor or the site. What is the average class size? How many students applied this year, and how many students were admitted? This was the first year, and we admitted 10 students. This was the inaugural class, and that was the goal, to admit 10 students. As some of you may know, occupational therapy is a profession where there's a lot of interest. And there were many, many applicants, probably over 200. Some of them did not have all of the prerequisite courses, and some may have been applying for the fall of 2016. We know now that there are possibly about 300 who, in terms of OTCAS, but also some of the applicants are likely applying to multiple schools. We will admit 20 students for fall of 2016. That would be the average class size would be 20. When will admissions interviews begin? Probably the admissions interviews will begin in either probably December would probably be the earliest that the admissions interviews would begin. If there are no more questions, please feel free to contact me. This PowerPoint will be posted on the website, and there will possibly be future webinar sessions on the occupational therapy program. Thank you for attending. Oh, one more question. I don't see what it is. One more question. You said if it doesn't get it, they will help you placement somewhere else, right? Mm-hmm. I do not expect that this would happen though. Thank you.